Across the wide span of the Arabian Sea to Vellore in South India marches MD International. This is Vellore's Christian Medical College, sponsored in part by more than 20 church groups in the United States. But to the villages surrounding Vellore, student doctors trained under an international staff move out in a mobile clinic to take the benefits of their training to the people. Founder Ida Scudder's niece, a doctor in her own right, accompanies this clinic on its journey, supervising the emergency work conducted at bus side and checking those patients who need her special attention. Besides carrying doctors to people, the mobile clinic carries its own pharmacy, dispensing modern medications to those long dependent on a few remedies found in nature. Many line up, too, to register their children for treatment for scabies, a skin infection caused by a small itch mite, often combated in special campaigns of Vellore's rural health program. Once the way is cleared to the infectious areas, all bedlam breaks loose as the children are scrubbed with coarse coconut fibers to remove the diseased tissue. After they are treated, like newly washed laundry, they are put out in the sun to dry.
In hands warped by leprosy, desperately clutching the air in exercise along the roadside, are the medical problems of India also reflected. Hope for such hands, and those of India's million other lepers, is found here in these hands at Vellore, undergoing special treatment by British orthopedic surgeon Paul Brand.
Now then, these are some leprosy patients, most of them non-infectious, who've all of them had some hand deformity, and they're getting mobilized, preparation for surgery. Here's a lad, you see, who's got typical claw hand. He can't get the hand out straight. Meet it, somebody. He can't get the hand out straight because these small muscles are paralyzed. Now, this boy had the same kind of hand, more or less, but he's had a reconstructive operation. You can see the scar back there. We picked one of his good muscles in the forearm, and we took a tendon graft from his leg and put the tendon graft right through his hand to each finger. And now you can see he's got...
But won't that muscle also get paralyzed?
Well, that's a good point. But, no, it won't. You see, we've surveyed several thousand of these hands now, and we find that in leprosy there's an absolutely precise pattern of paralysis. It always hits certain muscles and always spares certain.
Is that the pattern you worked out here at Vellore?
That's right. Now, this boy's had an operation on his other hand 3 weeks ago, so in about a month's time he should be fit for doing good work. And that's really the important thing. You see, these men, you can cure them of leprosy now, but what's the use of being cured of leprosy if you've got a deformed hand and an ugly face and you can't get back to your family, you can't get back to your job? So by giving them new noses and new eyebrows and working fingers, they can take a job and they can go back to normal life. All right, Doc?
In the hospital in Vellore, a serious operation proceeds under a doctor from Boston. A 4-year-old child suffering from a heart defect with which he was born undergoes what is known as a Blaylock-Tausig, or blue baby, operation to restore more normal blood circulation, a type of surgery never performed at Vellore until the arrival of thoracic surgeon Dr. Reeve Betts. Assisted by Dr. Gopinath, soon to study in the States, and other members of the Indian staff, Dr. Betts introduces a new and needed blood supply to the exposed heart by bringing down an artery to the arm and joining it to an artery to the lung. The entire procedure is observed by student doctors in constant training under the new chest surgery teaching program. Dr. Betts checks the newly introduced blood flow by comparing the color of his fingernails with the fast-returning color of the child's.
And one by one, sometimes the number totaling as many as 100 operated on in a single day, the patients, their eyes bandaged and protected from infection by drops of an antibiotic, are brought out and temporarily placed in the courtyard of the improvised hospital to rest. To rest and wait for the coming of the light. Light that will remove the burden of darkness from them, that so long has made them an object of pity, and save them from a lifetime of begging, the traditional occupation of the blind. This, to these, is the true meaning of the surgeon's mask, of the instruments that boiled on the kerosene stove, and the needle that gave them peace.
A week or so later, Dr. Rambo returns to the patients he left in care of a small staff. Returns to remove the stitches from the operated eyes and check their progress. To conserve time, he works over 2 patients at once. The bandages are permanently removed, but the shields are reapplied and worn for about 2 more days. In one eye after the other, he finds the promise of what is to come. Finally, the day to receive their glasses. Glasses that will be their new windows on the world. A world with darkness banished, hope rekindled, spirit reborn.
This, then, is the time for parting, the time for thank you and goodbye, in ways far more expressive than words, to the tall, spare doctor from America. As he stands there in a remote village of India, surrounded by the sick he healed, see in your mind's eye the multiplication of him throughout the whole world, and discover not only the blind homeward bound, seeing again, but all the earth's peoples, seeing that there is hope for peace when man is his brother's keeper.